Hello friends, I'm Masood and I'm going to discuss today a very important chapter that is regarding about the acid base balance in our body. One important thing that about is that was confusions about the different things that come into our mind when we study this chapter, as this is a chapter which is being studied in medicine, pediatrics as well as in surgery. First is that what is pH? That is the normal pH in our body that we know, that is 7.35 to 7.45. Now, what important thing that is regulation of acid base balance in our body. First, you have to think that what are the two systems which controls our acid base balance in the body. That is the two system, one is a renal system, another is a respiratory system. But you have to always remember that the respiratory system always works very immediately, that means within 1 hour, within hours, and the renal system takes time to compensate this acid base balance in our body. Now, what is mean by the four things that we discuss today is metabolic acidosis, metabolic alkalosis, respiratory acidosis, and respiratory alkalosis. In short, metabolic acidosis means that the level of, in short, when we discuss metabolic means bicarbonate levels. If the bicarbonate levels are decreased in the plasma, that means metabolic acidosis. At the same time, that there will be decrease in pH. And metabolic alkalosis means increase in bicarbonate levels. And respiratory acidosis means increase in carbon dioxide level in the blood plasma, and mostly in the, we define it in carbon dioxide levels in the arterial blood. And respiratory alkalosis means in decrease in carbon dioxide in the arterial blood, and that results in decrease in H ion concentration, and that will increase the pH. Very important thing that you have to remember about these is that, and when there is lot of confusion about that, is whenever there is metabolic acidosis, this is the primary disorder. For example, metabolic acidosis, that means decrease in bicarbonate levels in a body, that will reduce the pH down. Okay, so at the same time the renal function will not work, but the first compensatory mechanism is the respiratory system which comes into play, and after that renal system which starts absorption of this bicarbonate levels in the renal tubules. What important is the respiratory system, it will try to increase hyperventilation, that means there is respiratory acidosis, that means the pH is down, so it will the patient will hyperventilate, and there would be normal, that tends to normalize the pH, and which results into respiratory alkalosis. That means metabolic acidosis is there in the body, so it will try to compensate the body by respiratory system, and it will hyperventilate, and there will be decreased carbon dioxide now, and the pH concentration will be decreased, and this results into respiratory alkalosis. In short, you have to remember one thing, that whenever there is a mnemonic for this, that is whenever there is metabolic acidosis, there is respiratory alkalosis. Whenever there is metabolic alkalosis, there is respiratory acidosis. Whenever there is respiratory acidosis, there is metabolic alkalosis. Whenever there is respiratory alkalosis, there is metabolic acidosis. That is what we call as primary and secondary disorder, and that is primary disorder will result into compensatory mechanism which leads to the secondary disorder, that is the opposite of that, and it is very important to learn this thing. Okay, thanks for watching this YouTube video about acid base balance in our body. That's a very hectic chapter to understand, but I made it a little bit easier to understand. Thanks for watching this.